is Antoinette White. Narrated PowerPoint was developed as a handover tool to provide you with information gathered from the initial client consultation. It contains background information, medical history, pre-exercise screening, goal setting, a needs analysis, and an action plan. Key points from this will then be summarised. The client came to our service for a health and fitness assessment. Before proceeding with the initial consultation, an informed consent was undertaken and signed by the client. The client is a 23-year-old female who is a full-time university student, works part-time as a bartender, lives at home with her parents, and is a Women's Division 1 soccer midfielder. Her medical history reveals that she has not had any significant events. Her BMI of 27 indicates that she may be considered in the overweight range using this anthropometric measurement. Her blood pressure is considered within the normal range at 110/70. Pre-screening tools were used to obtain the client's medical history to determine risk or contraindications for exercise prescription, to assess whether there is a need for medical clearance or medical supervision. The QUT clinic form identified nil risk factors with the client's current physical activity meeting recommendations. Part Q and U revealed no risk factors and the client may participate in a fitness appraisal. The client was classed as a low risk and able to participate in low to moderate physical activity from the ESSA questionnaires. No metabolic risk factors were assessed as the client has not had a lipid or glucose profile. The fantastic lifestyle checklist result was very good with no concerning areas. The overall assessment from these tools was that the client did not have a coronary heart disease and or health risk factors requiring the client to not participate in exercise or for her to have medically supervised exercise. The client said she engages in a combination of moderately active exercise of 130 minutes per week, vigorous physical activity for 90 minutes per week. This falls within the Australian guidelines. The client identified a number of goals she would like to address. Her health goal is to decrease abdominal fat, her behaviour goal is to have more energy throughout the day, and her exercise performance goal is to increase her cardiovascular fitness. As mentioned earlier, the client wishes to decrease her abdominal fat. The current BMI of 27 falls within the overweight range, and when combined with a waist circumference of 84 centimetres, places her at an increased risk for type 2 diabetes, hypertension and cardiovascular disease. We discussed adding skin fold measurements and body density to assist in determining her body composition and an assessment of her daily energy needs and expenditure. We spoke about how changing the type, frequency, duration or intensity of physical activity can allow her to achieve her health goal of reducing body fat. The client would like to have more energy throughout the day, and many factors can affect a person's available energy. Nutrition and sleep quality were highlighted for further investigation. We discussed nutritional assessments such as a food diary, assessing the Australian dietary guidelines or seeking assistance from a dietitian. As the client works shift work, studies at university and plays soccer competitively on the weekends, she is going to use a sleep monitor to help her focus and assess her sleep quality. The client is going to undertake a 3-day physical activity record to identify her activity patterns, and along with her food and sleep records, this will help identify any potential changes required to help her increase her energy levels. The client would like to increase her cardiovascular fitness. She spoke about her need to be fit for playing soccer as she does a lot of running as a midfielder. The predominant metabolic pathway in soccer is aerobic. Being able to sustain a high work rate for the full game is an advantage. Players also need to be able to sprint all out for at least 90 seconds and at a high intensity for 30 seconds during the game. Before developing an exercise prescription, it's important to establish the client's baseline fitness in the key areas identified by the client for improvement. A baseline will assist in ensuring the efficacy of the prescription for meeting the client's goals. Fitness evaluation will consist of a VO2 max test for cardiorespiratory fitness, a vertical jump to assess muscular power, a 1 rep max test to assess muscular strength, a wall sit to assess the muscle's ability to hold a contraction over time, and bodyweight squats to test the muscle's ability to perform contractions over and over. An initial consultation was undertaken with the client. It included a general background, medical history, pre-exercise screening, goal setting, needs analysis and an action plan. The client is physically active 23-year-old female with nil significant medical events or risk factors. She is a full-time university student, works part-time as a bartender, lives at home with her parents and plays Division 1 women's soccer in a midfield position. A set of goals, needs analysis and action plan were established. These were a health goal to reduce abdominal body fat, a behaviour goal of sustaining her energy levels, and an exercise performance goal of increased cardiovascular fitness. A needs analysis of each goal identified key areas for action. Action plans were established based on evaluating the client's current health fitness for exercise prescription. Thank you.